Assalamu alaikum dear students. Today we will discuss most important MLT Medical Laboratory Technology MCQs part 1A. The normal platelet count is option A 1 to 1.5 lakh per cubic millimeter, option B 1.5 to 4 lakh per cubic millimeter, option C 5 to 10 lakh per cubic millimeter, and option D 10 to 15 lakh per cubic millimeter. So the correct option is B 1.5 to 4 lakh per cubic millimeter. Explanation is normal platelet count range between 1 lakh 50,000 to 4 lakh per cubic millimeter. Blood urea estimation commonly uses option A urease method, option B Jeffreys reaction, C Benedict's test, and option D Pepstein. So the correct option is A urease method. Explanation: urease enzyme break down urea, releasing ammonia, which is then measured. Subscribe now and press the bell icon. Never miss an update from early technologist. A loop used for urine culture is calibrated to option A 2 ml, B 0.1 ml, C 3 ml, and option D 10 ml. So the correct option is B 0.01 ml. Explanation is 0.01 ml loop is a standard for quantitative urine culture to count colony forming unit. The causative agent of tuberculosis is option A Streptococcus pneumoniae, B Mycobacterium tuberculosis, C Haemophilus influenza, and option D E. coli. So the correct option is B Mycobacterium tuberculosis. The acid fast bacilli causes pulmonary and extrapulmonary tuberculosis. Bilirubin estimation uses which method? Option A Jeffreys method, B Diazo method, C Benedict method, and option D Nessler's reaction. So the correct option is B Diazo method. Explanation is bilirubin reacts with diazotized sulfuric acid to form a colored compound measured photometrically. So hematocrit measures option A hemoglobin concentration, B WBC count, C peak cell volume PCV, and option D platelet count. So the correct option is PCV. Hematocrit is the proportion of blood volume occupied by red blood cells. The parasite causing filariasis is option A Plasmodium vivax, option B Wuchereria bancrofti, option C Giardia lamblia, and option D Entamoeba histolytica. So the correct option is B Wuchereria bancrofti. Explanation is this nematode blocks lymphatic vessels causing elephantiasis. So this is very important MCQs. Urine specific gravity is measured by option A colorimeter, B refractometer, C centrifuge, and option D spectrophotometer. So the correct option is B refractometer. Explanation is measures a refractive index to determine concentration and specific gravity of urine. Standard staining for peripheral blood smear is option A Pepstein, B Leishman stain, C Ziehl-Neelsen stain, and option D Silver stain. So the correct option is B Leishman stain. Explanation is Leishman stain is commonly used for blood films to visualize cell and parasites. Creatinine estimation uses which method? Option A Jeff's method, B. Biuret method, C. Urease method, and option D. Glucose oxidase method. So the correct option is A. Jeff's method. Explanation: creatinine reacts with picric acid in alkaline conditions to form a colored complex. The ABO blood grouping is based on option A. Hemoglobin level, B. Presence of antigens on red blood cells, and option C. White blood cells WBC count, and option D. Platelet aggregation. So the correct option is B. Presence of antigens on red blood cells. So explanation is here: ABO blood system depends on the presence of or absence of A and B antigens on red blood cells. Function of neutrophils is option A. Oxygen transport, B. Phagocytosis of bacteria, C. Clotting, and option D. Antibody production. So the correct option is B. Phagocytosis of bacteria. Neutrophils engulf and destroy bacteria, acting as the first line of defense. Eosinophilia is most commonly seen in option A. Bacterial infection, B. Viral infection, C. Parasitic infection, and option D. Fungal infection. So the correct option is C. Parasitic infection. Explanation is: elevated eosinophils are typically associated with parasitic infestations and allergies. So, which instrument separates blood components? Option A. Colorimeter, B. Centrifuge, C. Incubator, and option D. Spectrophotometer. So the correct option is B. Centrifuge. Explanation is: centrifugation separates blood into the plasma, buffy coat, and red blood cells based on density. So this is very important MCQs. The causative agent of syphilis is option A. Neisseria gonorrhea, B. Treponema pallidum, C. Chlamydia trachomatis, and option D. Haemophilus ducreyi. So the correct option is B. Treponema pallidum. Explanation is: Treponema pallidum, a spirochete, causes syphilis. The normal pH of blood is option A. 6.8 to 7, B. 7.35 to 7.45, option C. 7.8 to 8, and option D. 8.5 to 9. So the correct option is B. 7.35 to 7.45. Explanation is: the body maintains blood pH tightly between 7.35 to 7.45 for normal cellular function. The anticoagulant used for blood glucose estimation is option A. ADTA, B. heparin, C. sodium fluoride, and option D. citrate. So the correct option is C. sodium fluoride. Sodium fluoride inhibits glycolysis, preserving glucose level in blood samples. The causative agent of malaria is option A. Giardia lamblia, B. Plasmodium species, C. Leishmania donovani, and option D. Trypanosoma cruzi. Okay, the normal pH of blood is option A. 6.8 to 7, option B. 7.35 to 7.45, C. 7.8 to 8, and option D. 8.5 to 9. So the correct option is B. 7.35 to 7.45. So explanation is: the body maintains blood pH tightly between 7.35 to 7.45 for normal cellular function. So this is very important MCQs. The anticoagulant used for blood glucose estimation is option A. ADTA, B. heparin, C. sodium fluoride, and option D. citrate. So the correct option is C, sodium fluoride. Explanation is sodium fluoride inhibits glycolysis, preserving glucose level in blood samples. The causative agent of malaria is option A, Giardia lamblia, B, Plasmodium species, C, Leishmania donovani, and option D, Trypanosoma cruzi. So the correct option is B, Plasmodium species. Malaria is caused by Plasmodium parasites transmitted by Anopheles mosquitoes. Normal serum sodium level is option A, 110 to 120 milliequivalent per liter, option B, 135 to 145 milliequivalent per liter, C, 150 to 160 milliequivalent per liter, and option D, 165 to 175 milliequivalent per liter. So the correct option is B, 135 to 145 milliequivalent per liter. Explanation is normal sodium level is 135 to 145 milliequivalent per liter, essential for fluid balance and nerve function. The function of lymphocytes is option A, clotting, B, oxygen transport, C, immunity, and option D, phagocytosis. So the correct option is C, immunity. Lymphocytes produce antibodies and regulate immune responses. Which vitamin is essential for clotting? Option A, vitamin A, B, vitamin B12, C, vitamin C, and option D, vitamin K. So the correct option is D, vitamin K. Explanation is vitamin K is crucial for synthesizing clotting factors in the liver. Benedict test is used to detect option A, protein, B, glucose in urine, C, ketone bodies, and option D, bilirubin. So the correct option is B, glucose in urine. Explanation is Benedict test detect reducing sugars like glucose in urine. The term leukocytosis refers to option A, low WBC count, B, high WBC count, C, low platelet count, and option D, high RBC count. So the correct option is B, high WBC count. Explanation is leukocytosis indicates an elevated white blood cells count, often due to infection. Microhematocrit is used for option A, blood glucose estimation, B, hematocrit or PCV determination, C, WBC count, and option D, platelet function test. So the correct option is B, hematocrit or PCV. Explanation is microhematocrit measures peg cell volume using capillary tubes. If you like this video, please सब्सक्राइब माई यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें। इंडिया इंक प्रिपरेशन इज़ यूज टू डिटेक्ट ऑप्शन ए, कैंडिडा, बी, क्रिप्टोकोकस न्यूफॉर्मेंस, सी, प्लाज्मोडियम, एंड ऑप्शन डी, ट्रिपनोसोमा। So the correct option is B, Cryptococcus neoformans. Explanation is India ink is specific for Cryptococcus neoformans, particularly in CSF sample for diagnosing cryptococcal meningitis. Sick test is done for option A, tuberculosis, B, diphtheria, C, typhoid, and option D, cholera. So the correct option is B, diphtheria. Sick test checks for immunity to diphtheria toxin. Thank you for watching my videos.